How to prevent tuberculosis. Good morning, good afternoon, good evening, wherever you may be tuning from. I am Florence, a public health specialist, and today we are here to talk about something incredibly important that affects millions worldwide. That is tuberculosis. For too long, tuberculosis has been shrouded in misconception and stigma. Many still believe it is a disease of the past or one that only affects certain populations. But the truth is, TB remains a major global health challenge. In 2022 alone, 10.6 million people fell ill with tuberculosis, and it tragically claimed approximately 1.3 million lives. That is a staggering number, especially from a disease that is both preventable and curable. The good news is we have the knowledge and tools to fight back, and each one of us has a role to play. Today, we are going to demystify TB and empower you with the most current facts and effective strategies to prevent its spreads. Because together, yes, we can end tuberculosis. Here are the detailed prevention strategies. TB is caused by bacteria called Mycobacterium tuberculosis. It is an airborne infection, meaning it spreads through the air when a person with active pulmonary tuberculosis disease coughs, sneezes, talks, laughs, or even sings. These tiny droplets containing the bacteria can linger in the air for several hours, especially in enclosed, poorly ventilated spaces. This is why good ventilation and air quality are paramount. Now let's dive into the key prevention strategies. Number 1, early diagnosis and treatment. These are the cornerstone of prevention. This is perhaps the most effective way to prevent tuberculosis from spreading. A person with infectious TB can infect 10 to 15 other people annually. But once diagnosed and started on proper treatment, most patients are no longer infectious after just 2 weeks of taking their medication. So what does it mean for you? 1. Know the symptoms. A persistent cough lasting 2 weeks or more, fever, night sweats, and unexplained weight loss are common signs of TB. Don't dismiss them just like that. Number 2, seek medical attention promptly. If you experience these symptoms, especially if you have been in contact with someone with TB, get tested immediately. The World Health Organization recommends rapid molecular diagnostic tests, which are faster and more accurate, even detecting drug-resistant forms of tuberculosis. Number 2, complete the full course of treatment. If you are diagnosed with the active tuberculosis, it is crucial to take all your medication exactly as prescribed for the entire duration, typically 4 to 6 months. Stopping early or missing doses can lead to drug-resistant tuberculosis, which is much harder and more expensive to treat, requiring longer regimens and potentially painful injections. This is a crucial message. Many countries utilize directly observed therapy, or DOT, where a healthcare worker watches you take your medication. This ensures adherence and greatly increases the chances of successful treatment and prevents drug resistance. Preventive treatment number 2 is TB preventive treatment. That is protecting those at risk. Not everyone exposed to TB bacteria will develop active disease. Many people have what is called latent tuberculosis infection. The bacteria are in their blood, but they are not sick and cannot spread the disease. However, latent tuberculosis can progress to active tuberculosis, especially if your immune system becomes weakened. For individuals at risk or individuals at high risk of developing active tuberculosis from latent infection, tuberculosis preventive treatment, or TPT, is a game changer. This involves taking medication for a shorter duration, often 3 or 4 months, to prevent the latent infection from becoming active disease. This is particularly important for people living with HIV, close contacts of someone with active tuberculosis, and individuals with weakened immune systems due to other medical conditions or treatments. Highly current data and studies show that, including in developing countries, are showing great success with shorter TPT regimens, improving patient compliance and overall effectiveness. Prevention strategy number 3 is vaccination, that is boosting our defenses. The Bacillus calminate guerin, that is BCG vaccine, is the only currently licensed vaccine for tuberculosis prevention. Effectiveness of BCG is particularly in young children, offering significant protection against severe forms of tuberculosis like TB meningitis. Its effectiveness in adults, particularly against pulmonary TB, is more limited. Global use. BCG is widely used in countries with high burden of tuberculosis, in regions with lower TB incidences, like the United States. It is generally not recommended for the general population, but may be considered for certain healthcare workers or individuals with prolonged exposure risk. While BCG is valuable, the global TB community is actively working on developing new and more effective tuberculosis vaccines to combat the disease in all age groups. The TB Vaccine Accelerator Council, launched recently, is a key initiative in this effort. Prevention strategy number 4 is infection control measures, that is reducing airborne spread. Simple yet powerful actions can significantly reduce the airborne spread of TB. Good ventilation. TB bacteria thrive in small, closed spaces. Open windows, use fans, and ensure good airflow in homes, working places, and public places. In healthcare settings, specialized ventilation systems and negative pressure rooms are crucial. Another thing is respiratory hygiene. If you have symptoms of tuberculosis or are diagnosed with active tuberculosis, always cover your mouth and nose with a tissue when coughing or sneezing. Dispose of used tissues properly in a closed bag. Another thing is masking. While general mask mandates might vary, wearing a high-quality mask like an N75 respirator in healthcare setting can prevent the spread of tuberculosis droplets. Another thing is isolation. Individuals with infectious tuberculosis should stay home from work or school and avoid close contact with others until they are no longer infectious, as advised by their healthcare providers. Sleeping in a separate room for family members is also recommended. Strategy number 5 is strengthening healthcare system and addressing social determinants. Beyond individual actions, broader social efforts are vital. Number 1 is robust public health infrastructure. This includes strong tuberculosis prevention programs, efficient case finding in identifying new cases, contact tracing, and access to quality diagnostics and treatments. Another thing is addressing vulnerability. Over 80% of tuberculosis cases are death which affect marginalized people in low and middle income countries. Factors like poverty, overcrowding, malnutrition, and limited access to health care fuel the disease. Addressing these social determinants through equitable access to services, improved living conditions, and human rights-based approaches are crucial for ending tuberculosis. Another thing is integrated care. For individuals with core conditions like HIV, integrating tuberculosis and HIV services is essential, as HIV is the strongest risk factors for tuberculosis progression. In summary, these are the key takeaways. Let's quickly recap the essential ways to prevent tuberculosis. Number 1 is early diagnosis and completing of treatment are paramount to stopping the spread. Another thing is TB preventive treatment, which protects those at risk of developing active disease. Vaccination using BCG. It offers protection especially for young children. Good infection control practices like ventilation, respiratory hygiene, and masking minimizes airborne transmission. Strengthening health system and addressing social inequalities are fundamental to the global fight against tuberculosis. In conclusion, the fight against tuberculosis is a shared responsibility. By being aware of the symptoms, seeking prompt care, adhering to treatment, and advocating for stronger public health initiatives, we can collectively make a significant impact. Remember, tuberculosis is preventable and curable. With renewed global commitment, increased investment in research and development, and a focus on equitable access to care, we are closer than ever to achieving the ambitious goal of ending tuberculosis. End tuberculosis. Let's commit to knowing the facts, taking action, and spreading hope, not disease. Together, we can end tuberculosis. Thank you.